our STEM Center Black History Month event. And today we are highlighting 3 individuals who work within various areas of healthcare or with individuals that deal with health issues. And we're going to talk a little bit about some of the disparities that are currently happening within the community of color. So first I want to introduce Joelle Burvell. Joelle is a medical student and a TikTok's 2021 Voice for Change. Joelle is committed to fighting health disparities in medicine through education. And then we are also joined by Joya Williams. Joya is a UTSA alum and a master's candidate at Texas A&M University-Corpus Christi. Joya has changed many lives through her work with a nonprofit organization. And then we are also joined today by Dr. Carolyn Tubbs. And she is an associate dean. I just lost my screen. She's an associate dean of the colleges of Arts, Humanities, and Social Science, and an associate professor and program director for the Marriage and Family Therapy program at St. Mary's University. So I want to thank you 3 today for being a part of our panel. And so I want to give you all an opportunity to introduce yourselves a little bit more and just tell us a little bit about yourself, just how you got into your current position, and any other items that you might want to share with us. So Joelle, we'll go with you first.
Great, thank you so much for that kind introduction. So hey everyone, once again, my name is Joelle Burvell. I'm a 3rd-year medical student right now at Washington State University, but I grew up originally in Seattle, Washington, a little bit north of the city. My parents are both from Ghana, West Africa, which I think has a huge impact on my story and who I am and the work I do today. But I was born actually in Canada, then moved here afterwards. I went to undergraduate at Yale University, where I majored in microbiology, and then Boston University for my grad school program, and then came back to Washington State afterwards. But my story really begins from a young age. I had always thought about going into medicine from when I was a kid. I remember I found a little paper where I'd wrote down that I wanted to be 3 things: a vet, a doctor, or a lawyer. And I really wanted to be a vet, loved animals. And then as I kind of went through my life, so many different experiences led me down the medical path. One of the first was from my grandma, who used to take care of us when we were younger. While my parents were out working, my grandma was actually the person that took care of my siblings and I. And she didn't speak any English because she grew up in Ghana, only came to the United States to take care of my siblings and I. But she had so much love for all of us, and she wanted to kind of be that person for us and to take care of us when our parents weren't around. She ended up going back to Ghana when I was in about 7th grade, and she ended up passing away from malaria. And the way she passed away, though, was when she got to the hospital having a crisis. The hospital had told her that she actually needed to bring her own tubes, that they didn't have the tubing that was necessary to hook her up to the machines. And as a kid, learning about that was my first experience understanding that disparities exist, that on a global level, but also learning that they exist here in the United States too. My sister has an autoimmune disease, and so we had always been in and out of the hospital growing up. And seeing doctors, but also seeing kind of the medical bills that were left over reminded me that care doesn't begin and end in the hospital, but it has so many different spaces. So I think all these things have come into the work I do today about health disparities, and I know we'll get into that a little bit more, but want to introduce a little bit of my backstory.
Thank you. Joya, we'll let you go ahead and introduce yourself next.
Sure, that's a hard story to follow. Mine is much more simple. I'm born and raised in Corpus Christi, Texas. I graduated from UTSA in 2016, and I'm currently in the practicum portion of my master's program at Texas A&M Corpus Christi, so I'm almost done. And practicum just means I see clients, but I'm heavily supervised. I got into mental health literally because my best friend went through a breakup and I helped her through it. And I was like, I want to do this for the rest of my life, like help people go through tough times. And here I am. I currently am the Director of Volunteer and Community Outreach for Habitat for Humanity in Corpus Christi. I've been in nonprofit work since I graduated, and I love it. I love helping people in whatever way that may be. And so now I'm just looking to graduate and work towards my LPC and start making a difference there. That's it.
Thank you. Dr. Tubbs?
Sure. Good afternoon or good morning, everyone. And thank you, Joelle and Joya, for sharing your stories. It's interesting to me that we're kind of showing the progression from early graduate school to medical school to career in terms of our stories. My name is Carolyn Tubbs, and I'm actually now the Vice Provost for Academic Affairs at St. Mary's University. As the Vice Provost, I just basically evaluate academic programs, help to form and shape the academic affairs for our university. But before that, I was an Associate Dean in the College of Arts and Humanities at St. Mary's University. And during that time, the entire time, I've been a faculty member in the Marriage and Family Therapy program at St. Mary's University. We have a master's and doctoral program, and I currently still serve as a chair on dissertation committees for our doctoral students. I'll have to give a truncated version of my story because I'm much older than Joelle and Joya. But the way that I came to my field was as an undergraduate. My undergraduate degree was in elementary education, and I thought that I would enjoy elementary education, and specifically I was a teacher of the deaf and taught for right after, between my master's and my undergraduate degree, I taught here in San Antonio at one of the elementary schools downtown. And then in my third year, I was transferred to Sam Houston High School to work with the high school deaf students. And it was during that time that it was an epiphany for me, in that for many of the deaf students that were attending Sam Houston at that point in time and that I was teaching, many of them could not communicate with their parents. So even when I was in their homes doing home visits, I still had to interpret for them as they were talking to their parents, and I was in some ways mystified by that. They had their own home sign language, but it wasn't the sign language that we were teaching them in school. But I think the thing that really made me start thinking about, okay, I need to go ahead and finish pursuing my master's was one student who, when I went to her home, she was very angry and aggressive with her parents, and as I was interpreting between them, I just realized how helpless I felt as an educator in that moment. And I thought, I can't change the world doing this because I can't change this situation. I need more skills. So then I went back to school and got my master's in human development and family studies, and then went on to get my PhD in that same area, and then to also develop my skills as a marriage and family therapist, so that when I go into family situations, I have more skills. And so that's definitely my academic field also.
Thank you. Y'all's stories are actually really compelling, and it also makes me think for myself, how influential you all are, even to older individuals like myself, who are currently, I already have a career, but just listening to what you all have to say, it makes me think like, oh, is there more that I could be doing within my own personal careers in life, right? But I want to go ahead and start with the very first question. And Dr. Tubbs, I will let you answer first, and then we'll, go on with the others. But what hardships did you face as a person of color in your career and while completing your education, and how did you address these issues?
As I was thinking about this, I think one of the things that came to mind for me first, and I know this is going to be a controversial point or thing to say, One of the things that I realized that was a hardship for me once I was not in that situation was actually living in Texas. I grew up in El Paso, Texas. I went to school at Texas Tech, and then I went to Indiana for my doctoral degree. But what I realized is that who I was as a Black person in other parts of the country was not who I was as a Black person in Texas. And I realized that I was limited as a Black person in Texas. And there's much more to that, but it was just very freeing to not be in Texas. And I'm not saying that people, are beating Black people in Texas and those things, but you just realize the nature of the institutional and systemic racism that goes on that you can't even see unless you're outside of it, because my opportunities grew exponentially once I left Texas. I was still the same person doing some of the very similar things, but I don't think my opportunities in life would have grown if I had stayed in Texas my entire life. And I've gone to school in Indiana, came back to Texas, was faculty in Minnesota, was faculty at Penn State, also lived in Canada for a while and taught in Canada, and then taught also in Pennsylvania, and just saw how those opportunities opened up for me. So I, take that for what it's worth, but that's something that really stays with me. And in many ways wishing that students would have an opportunity to kind of travel outside that comfort zone and see what's offered in the rest of the world and in the US. I guess the other thing that came to mind in terms of what the hardship I faced as a person of color while I was getting my education, and how those issues have changed, is I became aware that we've really progressed in the areas of cultural competence, cultural responsiveness, social justice, and equity since the days of my doctoral degree. And I have to laugh because what people are doing today, those were my dreams, about 20 years ago. I just want to be able to, bring people together and have this conversation that's beyond race, and we're still having that conversation. So it's kind of humorous, but it's saddening too at the same time that we just can't seem to get any traction with those wills. But I think the thing that I tried to do to address those issues was to speak out as a student about institutional racism, systemic racism, and misogyny. But I realized that I had to do it in ways that it could be heard and not fall victim to someone perceiving me as an angry Black woman who's saying these things and who is not grateful for the opportunities that are open to her. And I appreciate that now for the current generations, they are really pushing those conversations much, much further, and really bringing lots of critical voices to what, and asking what are we doing as a country around these issues of social location, such as race, ethnicity, class, ableism, sexual orientation, that the younger generations versus what we did as older generations, which was we tried to give the message in a way that felt comfortable to people. I appreciate the younger generations for being much more proactive, assertive, and activist about those messages and saying, no, we don't understand why we're still in this situation. We've got to change the situation. So I think my piece was doing those same things, but not being able to do them as overtly as I see current generations, and I have to applaud everyone here for doing that. And then just deciding that regardless of how I feel, I've got a longer term goal, and that nothing's going to deter me from that goal. That's the other way that I addressed it, is that, even if I have to go through this, I know what my goal is, and nothing's going to stop me. So if I have to, put my head down and do what I need to do, I'm putting my head down and doing what I need to do, because then, at least for my generation, and I don't know that it's going to work for your generation, that allowed me those opportunities, and then to move to associate dean, and then to move to a vice provost, doing just kind of making sure I always know what that long-term goal is, and assessing opportunities, and I guess even situations that are upsetting or uncomfortable, weighing them against, okay, is this worth in any ways detracting from that long-term goal? And sometimes it is that I need to stop in that moment and take a stand and say what needs to be said in that moment. So I'll stop there.
Thank you. That's a really great story. And I mean, to think about like how you said, you know, being a person of color in Texas, I mean, we're experiencing that now, right? It's still, which is really a saddening thing, but I mean, we're also experiencing it throughout the United States. So, I'm glad, it's nice that you brought that to the forefront on that topic. Joya, how about you? Was there any hardships that you faced in your career and while completing your education, and how did you address them?
I feel like I got really lucky in my master's program in that there's a multicultural aspect in every single class. We are forced to like see other points of view and to, you know, evaluate ourselves and our biases that we may have. I will say that now as a practicum student, seeing clients, I've run into hardships where people tend not to respect my opinion or what I have to say because I am a woman of color and I'm usually younger than they are. And so although we are doing the work and having the conversation, and even my supervisor who considers herself an expert in like multiculturalism, some of the dismissive things that happen in our sessions go over her head. And so, you know, we still have work to do with multiculturalism, even in the counseling world where everyone's like touchy-feely and understanding and sharing, there's still that disparity. But more so in my experience, it has been in actually working with clients and not so much in the educational system.
Wow, that's interesting. Joelle, how about you?
Yeah, Dr. Tubbs and Joya, thank you for sharing your stories. I think it's so instrumental to see the pathway and the things that you had to think about and go through in order to understand where you are today. When I think about my own journey, I think a lot about systemic barriers, but also the microaggressions that we face in institutions. I think that's kind of what everyone is talking about. I remember in high school, my high school was 2,400 students. I was one of 10 Black students. So just by nature, I became the token of like what people would think about a Black person, or if they didn't know anyone else that was Black, they would take what they see in the media and put that on me. I remember I was called things like an Oreo, meaning that I was Black on the outside, but I acted white on the inside. So these assumptions that were made about me because of my skin color. And when they called me an Oreo, it was usually because I was student body president for all 4 years, or maybe I was in all AP classes. And so they were making these assumptions that I couldn't be Black, or I'm not Black enough because I'm in these classes or doing things that seem out of the norm. And the way I would tackle that was literally to ask them, what do you mean by that? So someone say, hey, Joel, you're an Oreo. I say, what do you mean by that? They'll say, oh, you act white. And I'll ask them, what does it mean to act white? And then they'll usually respond, oh, like you're in all AP classes or you're student body president. And so my response to that is, are you saying Black people can't do that as well? And I think that always became my way of combating these things, was questioning and really interrogating people, not in a way that attacked them or what they were saying, but to help them unravel what biases and what systemic things they had been taught throughout their lives that they're perpetuating without even realizing it. I actually had a girl like years later message me on Facebook and say, I'm so sorry for calling you like an Oreo. I've taken a lot of classes and learned about how dismissive that can be, to be saying these things that are essentially telling someone what their identity is and what they can or can't do. So that was me throughout high school. I was in this environment where I was constantly having to like kind of defend myself. I remember even when I got into Yale for undergrad, It was funny because we were in AP Gov and we were having a debate on affirmative action, and someone turns to me and goes, "You got in because of affirmative action." And I had to turn around and say, "What's your GPA? What have you done? Like, like, have you done anything outside the school?" And then I was just mad. So I kind of went off my soapbox. I was like, "I have a 4.0. I started a nonprofit. I was president all 4 years. I'm multicultural club president, honor society president. I have all A's. What have you done?" But it's always these times where we have to prove ourselves to be better, that we have to be exceptional or be better. I think for me, those have been the times that I've had to push through. When I got to Yale, unfortunately, it didn't change. Or there were times where things were said that made me feel like I didn't belong as well. As a freshman, I took chemistry, and I thought I was prepared, thought I was ready for the classes, went in, I didn't do so hot on my first exam. Remember, I went to the advisor or the teacher for that class to kind of be proactive and say, "Hey, let me make sure that I get ahead of this," and meet with him. The first thing he says when I walked in, and he looked at my test score, he said, "Are you an athlete?" Because if you're on the football team, I know a lot of football players come in here and they take these classes, then they drop out. So don't worry, you can drop out right now. And I had to turn and be like, no, like, one, there's nothing wrong with athletes, right? Being at schools on academic scholarships. But two, for you to make that assumption about me and to have this kind of prejudice about athletes in the first place is horrible. Because when a student wants to come to you to better themselves, you have this in the background already thinking about this, and you're not actually doing them a service. So I think these are all the ways that these types of things get encoded into systems and into the ways that people, and especially those in power and those who have control over kind of the things that we can do in the future, can impact it. And I will say I've been very lucky because I grew up in an all mostly white community. I think I've learned how to navigate it. But for people who have never experienced that, it can be very difficult and jarring. I've had this like every day, and I figured out, how do I manage it? How do I relegate, and how do I actually question in a way that doesn't feel like it's attacking, or I become that like angry person who's always talking about race, but doing it in a way that's interrogating. And I feel like that's what I do right now with my social media. I really try to bring things out and bring in conversations in a way that allows people to join the conversation instead of feeling like as if they're attacked. I think it's hard, especially today, when we're having so many conversations about race. Many people get uncomfortable when we talk about race, but I don't think it should be something that we're uncomfortable about. It should be something that we're open to learning about, open to listening about, and want to actually better ourselves. It's never personal attack, but it's attack on systems and the things that we're taught. So that's kind of some examples of what I've gone through and the ways that I've tried to tackle those.
And can I just add on to what Joel was saying is many times that systemic racism can be internalized, and you're not only getting those comments about being an Oreo from European American folks, you're getting it from your own community, whether it's African American or other communities. When people see you trying to advance and it's just not, I don't know if it just doesn't feel like it's the cultural norm or whatever script is playing in their head, there's a lot of pushback from your own community and people questioning why you're acting in certain ways or seeking certain opportunities. And that can also not only be challenging, but deeply hurtful to have those type of pushbacks too.
Absolutely. I don't want to take it away from what you all said, but I think it just shows within all cultures, it brings to mind, like the whole Encanto conversation about, all the different characters play a different role in how we have to basically internalize a lot of our, of who we are in order to fit into this mold that, they want us to be, or that somebody else thinks that you should be because of your race. So thank you all for sharing that. So now, Joelle, I'll start with you on this next question. Looking at your career and looking at the medical field that you're in, what disparities do you see that affect your the patients that you might be working with, and how can we look at trying to eliminate those disparities? Because I know in healthcare there's a lot of things that I don't want to say African American, but just people of color in general are not probably given the best healthcare opportunities than others.
Absolutely.
So you can share a little bit.
Definitely. And as you noted, there's unfortunately a lot in the field of medicine. And that actually is what I dedicate my TikTok to. I'll get to that a little bit, how I maybe got started on that and the work that I talk about. But in terms of disparities that impact individuals of color, underrepresented minorities in medicine, you can look at things like the Black maternal mortality rate. Black women are unfortunately more likely to die, 3 times more likely to die than white women in the United States. You can look at kidney failure. Black individuals overall are more likely to die of kidney failure than other people, and to wait longer for a kidney transplant than other races. You can look at cancer rates. Black men specifically are more likely to have increased rates of cancer and to die from their cancer or to be treated later than other people. And the reason why is because it relates a lot to systemic racism. So for Black women, often pain goes undiagnosed, or complaints aren't talked about. When it comes to GFR, there's actually an equation that is a racial correction where there's a multiplier added on top of kidney functioning, meaning that a Black individual has to show worse kidney functioning than someone that's non-Black in order to get treatment. And then when it comes to things like cancer, there's actually studies that show individuals that live in areas that were historically redlined are more likely to have increased rates of cancer. So all these things I talked about aren't because of race, it's because of the systems that act on race and the socio-political conversations that race has become about. So that's really what I talk a lot on my social media channels. So on TikTok, I took to TikTok about, I'd say, 1.5 years ago now to really discuss how disparities in medicine manifest. I think a lot of people think about the field of medicine as very objective, and it is in that there's a lot of data, but you have to think about where that data comes from and how it came about. So for example, like we use things that are called PFTs, pulmonary function tests. And there's a lot of data out there that unfortunately says that people that are Black and Asian have lower lung functioning. So that means when you give someone a pulmonary function test, it is encoded into it automatically to assume that lung functioning in those populations are lower. But when you go back to the data and look at actually where the research came from, it was mostly done on slave populations. You can think about the conditions that those people had to live in. But yet still today, we still say these kind of things about lung functioning and these racial disparities, even though we know race is a social construct, and you can't look at someone's genes and say, hey, you are this specific race. It's a political categorization, a social categorization that we use. So those are just some disparities that exist. And I think in terms of how we begin to eliminate them, it starts with understanding they exist and then teaching students about it. Because I can personally say in my medical school, I didn't learn about half the disparities I told you about. I had to go out and do my own research, find my own research about it, and talk about it. And schools are starting to introduce anti-racist curriculum into medicine. And the reason why is because it has direct impacts on patients. If we have beliefs about Black women or Black men not experiencing pain, they're less likely to get pain medications. If you have these assumptions, someone that's in a sickle cell crisis, which means sickle cell disease, I don't know if everyone knows what that is, but sickle cell is a genetic disorder of red blood cells, where your red blood cells are in a sickle shape, and they can sometimes have an occlusive crisis, meaning they block your arteries or your veins and cause a lot of pain. But many times, doctors don't recognize that in patients, and they will send them home. There's actually a case in the UK where a patient sat in the emergency room after coming to the hospital and passed away because they didn't recognize his pain and they didn't recognize what he was going through. And these are all things that exist in the medical system, but it starts with the training to make sure that in medical school, the stage that I'm at right now, we're talking about these things so that when we become a doctor, it's not the first time we're seeing it, but we've actually discussed it. One other very visceral thing I like to talk about, because I think it is one way to really understand how these disparities manifest and the impacts they have, is dermatology. In medical school, we're taught to diagnose things on skin, but we're not taught often what it looks like on darker skin. It's always lighter skin. And things can look different. Eczema looks very different on white skin versus Black skin. Melanoma, skin cancer, looks very different on Black skin versus white skin. If we're not taught how to actually diagnose these things, it leads to later diagnoses in populations that have darker skin tones. So I think these are all disparities that exist. And unfortunately, there's a lot, but it takes understanding, education, and then really working towards dismantling each and every one, because there's a different step you have to take towards dismantling them.
Thank you. Dr. Tubbs, how about you in your profession?
So I was thinking about this in 2 ways. I guess if I think on the clinical end, the biggest disparity is the difference between the quality of care for African Americans who are experiencing mental health concerns versus non-African Americans. And when you look at the rates of mental illness in African Americans, they're very similar to the general population, but the disparities that exist, and I guess the disparities that exist fall under the category of a poor quality of care and lack of access to culturally competent care, just what Joelle was just talking about in terms of, you know, when a practitioner sees someone who's a person of color, do they understand the nuances there? If you think about African Americans in terms of mental health, only 1 in 3 African Americans who need mental health care actually receive it. And compared to non-Hispanic whites, African Americans, African Americans with any mental health illness have lower rates of access to services. Also, we see higher levels of illicit drug use and lower levels of treatment for that illicit drug use in African Americans. And compared to whites, African Americans are less likely to receive guideline consistent care. They're less frequently included in the research, and they're more likely to use the emergency room or primary care rather than going to a mental health specialist. And so that disparity exists in our field, and in terms of how to resolve it, actually I thought we were doing a pretty good job during the pandemic, and it's kind of unusual to think of the pandemic as the kind of the context where this improves a bit more, but when the insurance companies began to relax some of their standards during the pandemic, then we saw many more African Americans attempting to access mental health care. And unfortunately, the insurance companies are going back to pre-pandemic criteria. And so I'm really concerned that, you know, the quality of care and the access of care for African Americans who are experiencing mental health issues will decrease because there's no intentionality to maintain that higher level of access for African Americans. I guess the other way I thought about this is in terms of African Americans who might want to go into mental health and into academia around mental health. And I think the disparity there could be captured in the phrase that there's very few research mentors for African American academics. And I think that my field has found a really helpful way to address this by partnering with other professional mental health fields in the federal government, specifically SAMHSA, or the substance abuse branch of the government, to fund and create master's and doctoral level fellowships that not only provide meaningful financial assistance to students interested in the field, but also convening a group of them twice a year in Alexandria, Washington, near the Washington, D.C. And in those meetings, they bring the top scholars from our field to that set of scholars to teach them about the important trends and emerging trends in our field. And then some of those connections convert into a mentorship and help to launch the fields of African Americans. So it's that clinical disparity as well as the disparity in terms of launching African American academics.
Thank you. Joya, how about you in your setting? How have you witnessed any of these disparities?
Sure. I feel like Dr. Tubbs covered a lot of it because I am also in mental health. But I feel like as a student, like when I was looking for a supervisor, I wanted to be supervised by another African American mental health professional, and there's none in my city. Like there's no supervisors. And so I feel like, you know, as people of color, we're most comfortable with people that look like us. And so if there's no one in your area that looks like you for you to talk to, that can be a deterrent to you seeking out, you know, help. And even then, if you take what may be considered a risk and speak to someone outside of your culture, and then you have a bad experience when it's common too, that's a deterrent as well to people of color seeking out therapy. And so I feel like that's a really big issue that we face, especially in Texas.
Yes, I agree. I mean, on the medical side, I see a lot of individuals within all areas of color. They are more, they get pushed to doing, the Obamacare, insurance instead of, given that opportunity to get a better sort of, get a higher premium insurance. They might be on Social Security because they are disabled for some sort of reason. Maybe it is a mental health issue, and they're ending up paying tons of money for healthcare, and so then they don't want to go and get seen. So then you have it's kind of like a double-edged sword, because they either can get seen and see these disparities within these various areas, but then also they do get seen and then they get these huge bills, right? So I think that's I mean, I've seen that. I used to work where Healthy Start, and it's a initiative by the White House, to help with mothers who are pregnant, to make sure that the fetal death numbers decrease. And so I remember a lot of the conversation that we would have is based around mental health, just purely medical education, and making sure that these women of color got opportunities to actually have someone be their advocate for them, because they didn't know what they were doing. So it's really great that you all are in the field and you all are educating individuals about these things, because I think that the conversation needs to happen and it needs to be brought to light. So thank you all. So
Erin, can I add to that?
yes, ma'am.
Because I think you've hit on something really important. For someone to see me, it's $140 an hour. Now, how many of us can pay $140 an hour? And so that also kind of leads to that disparity in terms of who needs the services. One of the ways that I and many other mental health professionals try to address that disparity is there a certain amount of time per week that we dedicate to pro bono or to sliding scale fees, so that there's more access to what you would consider a more advanced or mature clinician versus someone who's starting out. But it's those type of things that also kind of lead to those disparities, and we have to begin to question ourselves as people of color and who are mental health professionals. Do we deserve to make the same amount of money that our peers do? But then are we cognizant enough of the disparities that we then build in ways to try to overcome those, or at least to address those?
Absolutely. I know that there's a lot of mental health experts that are trying to do that sliding scale. I think that's one of the things now, especially that insurances have decided to go back to charging again. I think that they are trying to do that sliding scale. So I will move into my next question. So do you think it's important for individuals of color to pursue the profession you're in, and why? So for, obviously we have a ton of students on with us right now. And so just giving them some insight as why it's important into going into the field that you're currently in. Joya, we'll go with you first.
Yeah, I think it's really important. Like I touched on earlier, like there's no one in my city, that's Black and a practicing clinician. And so there is a gap there for people that are specifically seeking out other Black professionals to see. And I also know that in Black culture specifically, we are taught not to seek out mental health. Like, pray about it, don't go to someone else about it. Like, God can fix everything. You don't need that. And so I think seeing other people in the profession and learning, like, no, like, this is important. It's okay to seek out help with your mental health. It's just as important as your physical health, will really make a difference, not only for other students like me, but in our community in general.
Absolutely. I think that's the most important thing, is that we all, I mean, I can't speak for others of color, but I know for myself, you know, within the Hispanic population, it's kind of like frowned upon to like seek out mental health. And so you, from my perspective, you hit the nail on the head with that one. Dr. Tubbs, how about you?
I think it's important that individuals of color pursue the field of marriage and family therapy because there are important cultural differences in how family is understood, in how family is performed, and how family is located, as Joya just indicated, you know, in terms of, are we located in a structure where, you know, God is really important to us? And so do we turn to God in all things without options to possibly seek mental health or even see mental health as something that God provides? And so family is located, because of those cultural differences, family is located in a social fabric that then begins to shape how family is understood. I think in the past, because European Americans dominated the field, all other families were normed against them. And if you didn't look like, you know, definitely in the past, Ozzie and Harriet, but I guess even more recently, I guess even the Cosby family, if you didn't look like certain types of family, there was something wrong with you. And I'm fairly sure that the fields have moved past that, but in the past, that was always a way of stigmatizing families of color. And so that acted as a barrier to them also seeking mental health. And as you heard Joya say, that, you know, when people can see someone like them, then they are more open to the option of seeking those services. And I think, as you would suspect, most of the families of color, when we think of them as, you know, do they have, you know, a certain amount of wealth, or, you know, are they two-parent, two children? A lot of the families are not going to fare well. They're not going to compare well to those families. And we just need that understanding in the mental health fields, that families can be unique structures and they don't have to look at like any one particular template. And so for me, that was important for me, having had my experience in education, to go in and find out what family was all about. And then how could the African American family, in its multiple iterations, begin to identify itself. So I would use that argument as a reason why more people of color need to go into the field of marriage and family therapy.
Thank you, absolutely. Joelle, how about you?
Yeah, I really want to reiterate that point. You can't see what you can't be what you can't see. I think that's so important, and especially in the medical field. In my field, less than 5% of physicians are Black in the entire field. You know, at my medical school, I was the first Black medical student at my school. And so I felt like a responsibility to make sure I opened up doors for those who came after me. But even beyond that, I think diversity is important for a whole host of other reasons, and research shows why. More diverse teams are more likely to outperform homogenous teams. So when you have more diversity, you're able to recognize different things. Authors of different studies show that different backgrounds have different experiences, different perspectives, and because of that, you can approach a problem differently than someone else may have traditionally approached it. There's also medicine discussion of what's called racial concordance, which means that studies show that students that are trained at more diverse schools are more comfortable treating patients from a wide range of ethnic backgrounds. And patients also feel more likely to listen to their provider when they feel that they're coming from someone that is either from a similar background, or at least understands where they're from. That leads to higher rates of trust. The patient-physician relationship is huge in medicine, is one of the things we talk about a lot. And it also leads to more adherence to medications. And when they come in, they're more likely to speak with you. I kind of think of medicine as being a detective. You need to figure out what's going on with your patient, but that means they need to trust you enough to be able to give you that information. If there's not that trust, you can't glean what's going on. And then when you look on the more macro level, there's also things like looking at clinical trials and the types of trials. If we don't have diversity in the people that are leading these studies, the doctors and the clinicians and the researchers that are leading clinical trials, they're not going to be thinking about things like, hey, maybe we should get into different communities. Maybe this clinical trial isn't really good because we're not getting people that aren't within the bus line, for example. If there's a bus route that comes to the hospital, or maybe we're not reaching the food deserts where they don't have access to food. If you're not thinking about all these different types of things in a clinical trial, and then you're not actually getting a representative study of the people that are going to be using your drug or your treatment down the line. And so, I mean, you can even think about that from even a gender perspective too. Women for a long time were excluded from clinical trials until like the 1980s, like a long time. It's crazy to think about that. Only men were used, similar things. And they started realizing that, hey, maybe we should be diversifying because it'll make a difference. And then it comes to public community and trust as well. If you're not having people that are coming from specific communities, being able to go back and talk about the importance of it, point blank, I mean, COVID pandemic, right? If you don't have a doctor from a community where there's a lot of distrust, are they going to be more likely to listen to someone that has never been from that community and is seen as an other, or someone who has come from that community, understands the things that are going on and can speak the same language and be able to tell them that? And language, not necessarily like literal language, but the language of medicine. In COVID, I think one of the huge talking points last year was the fact that Kizzmekia Corbett, who was the immunologist who worked with Dr. Fauci to create the Moderna vaccine, that she came from a Black community, and she was able to go back and speak with a lot of people about why she felt like this was important, her work as an immunologist, and to really break it down in a way that other scientists who had never been to those types of communities weren't able to. So I think all these things are really important, from the access to the understanding to the trust. I think it all are reasons why it's important to have people of color, and especially those that are underrepresented in medicine in this field.
Absolutely. I think also, like, if you are from those types of communities, you're able to break down particular topics to those individuals in a different way than if you were, removed from that different community, just because you understand their level of, I guess, understanding, right? So you're able to speak to them in the way that they need to be spoken to. So thank you all. So my last question is, what advice can you give to our students as they go, either as they're looking into pursuing the current fields that y'all are in, or just looking to, continue their education? What advice can you give them? Being a person of color, what advice can you give them? And we will go with Joelle, since you finished the last question, we'll go with you first.
Sure. Yeah, the advice I always give everyone is keep going. And I know that sounds simple, but I think there are times where people say things to make us feel as if we don't belong, or that we are not meant to be there. I think remembering that you deserve to be there. If you have a spot in your school, you are meant to be there. Finding people that are your mentors, whether that's someone that looks like you or that you just get along with and understands where you're from, those are all instrumental. So find mentors that aren't just going to be mentors, but are going to be advocates and sponsors for you. And I like to talk about the difference between those three things. A mentor is someone that, yes, they'll kind of give you advice, but that's what they leave it at. An advocate is someone that's going to go above and beyond, right? They're going to be like, hey, do you know about this student? Or let me reach out to this actual specific program on your behalf. And even better is someone that's a sponsor. They don't just put the words where it is, but they actually put the money too. They're like, I will pay for you to fly out to this place, or I will make sure to reach out to this person and personally put you in like an introduction, or I'll take you out to dinner with these specific people. They're putting you in the spaces where you should belong. So my advice is always keep going and find people who are going to be not just mentors, but advocates and sponsors.
Thank you. Dr. Tubbs?
I guess my advice would be go for it. If you're an undergraduate, if you know your long-term goal is to be in the mental health field, begin to take those courses while you're an undergraduate. And if your university has some form of community engagement, take an opportunity or opportunities to volunteer in arenas where you can have exposure to the mental health field, because that'll position you for graduate school. And if you're a graduate student, then getting clarity about which field of mental health you'd like to go into. If you are interested in the individual, then you would go more with psychology or with counseling. If you're interested in relationships, you would go more with the marriage and family therapy field. And if you're interested in helping people to get services, then you would go more with social work. But getting clarity about which field you'd like to engage, and then taking courses that are related to it. Even if you're, for example, in a counseling field, you can take the courses in marriage and family therapy, but then also looking for other graduate programs that has that particular field, and then pursuing that. And if you do have an opportunity to move your education on beyond the master's and go to PhD, pursue that, and not think of that as, well, no, that a person like me doesn't need to have a degree or doesn't deserve to have a degree like that. That you can see yourself in a broader context, having a larger impact on your world through getting more education and being able to touch more lives and contributing to the research around mental health in that particular area.
Thank you for that. Joya, how about you?
Sure. At the very basic level, if you're going to pursue mental health, make sure that you get into a KCREP accredited program, because you can't apply for licensure if you don't. But on a personal level, to Joelle's point, you're probably going to constantly feel like an imposter. Imposter syndrome is insane when you're in grad school and above. And like he said, just know that you are there for a reason. And as long as you're practicing empathy, that's at the very base of what mental health professionals do. We empathize. You're right where you're supposed to be, and just keep going. A lot of classes are very dry and they suck, but it's okay. Just keep going and you'll be fine.
Thank you. So now I'm going to open it up to the audience and let them ask some questions. So if you want to come off of mute, or we can raise hands, whichever is easier. And if you want to ask any questions, go ahead and ask them.
I have one. So I help lead the Alamo STEM ecosystem, and we are like a cross-sector partnership of like business, community, workforce, informal and formal educators. And we just want to support students in STEM and really bridge like youth, community, and workforce. So that's kind of our mission. And so being that those are some things that I'm working towards with a great community behind me and alongside me. I'm just curious, like, what advice do you have for policy and community advocates that lead student serving STEM programs and initiatives from like cradle to career, that really desire to support all students pursuing STEM and strengthen that pipeline, cultivate that pipeline, but more specifically, they want to support Black students in STEM. Any advice for policy and community advocates doing that work?
I can maybe jump in on this one, just because I've done a lot of mentorship and programs. I actually, when I was in college, I ran a mentorship program that was at 2 middle schools. And the purpose was to do longitudinal relationships to match Yale mentors with 6th graders. And then that was, so Yale mentors that were sophomores matched with 6th graders. So they were with them from 6th to 7th to 8th grade until the college students graduated. And I thought what was really important there was the longitudinal aspect of it. The fact that we weren't just creating a program that was a one-off, but we were creating relationships that were lasting, that we were meeting the parents, which is huge, right? It was like bringing them in as well to the same sessions. And then we were also trying to get into the community. So we did things like brought in the reptile man, which was really fun, where someone brought in like turtles and alligators and talked about the connection between veterinary medicine and like what does it mean to actually look at these animals and like in the ecosystem. So bringing in all those kind of conversations. We took them on trips to the Yale Brain Lab, where we actually had a neurosurgeon kind of show brains and talk about the different parts of the brain as well. And I think what really got me excited about that was I had done a program when I was in high school at the YMCA in Seattle, the Meredith Matthews YMCA, where every single Saturday we as high school and middle school students would meet at this place. They'd get us on a bus and they take us to a different STEM institution. So I remember we went to like the Bill and Melinda Gates Foundation, and we learned about malaria and how mosquitoes can like transfer that. We went to like a physics lab and actually got to play with electrodes and put them together. And I feel like all those types of things got me really excited about STEM from an early age. And it was really cool because it was on the weekend. It was people that would come in on their off time. I remember we went to like a 3D printing lab. I still have the little thing I created and 3D printed. So I'm always about any policies that are putting funding towards connecting students with early access into seeing what careers are possible. Because I think one of the common threads that we've all talked about is you can't be what you can't see. I think oftentimes you don't get that opportunity to be in these spaces. But for me, being in these spaces opened my mind to a world of possibility of like, whoa, I never knew that 3D printing was a thing, or that you can 3D print a musical instrument, or that you can 3D print actual parts for phones. You know, all these really interesting conversations that we were having that we were able to kind of go forward with. So that'd be my suggestion, is reaching out to companies, seeing if they'd be willing to bring students in, putting on hands-on activities that get them excited.
And Stephanie, I can only speak mostly to the academic side of that, and that is that in the programs that you design or advocate, that there be a component of cultural responsiveness written into those programs in terms of the structure of the program and any teaching or pedagogy that occurs there, so that whoever the instructors or the mentors are in that program, that they're very much embedded or educated about the community that they're serving, so that they can address some of the issues that may be barriers to students getting into a STEM program, especially women. And especially in Latino program or communities where there's different pulls on students in terms of wanting to complete their education. You know, do I need to take care of family? Yeah, I guess that would be the biggest one that comes to mind for me, because I work at the family, but just really getting a good read on what might be some challenges for a particular community in terms of students trying to make that transition into a STEM profession.
Thank you. We have one in the chat from Nicole. I think you might have already touched on this, Dr. Tubbs, but it was about how did you choose your specific aspect? How did you choose your specific aspect, like family counseling? They want to help all walks of life, and it's hard for them to choose. So they're majoring right now in psychology, and they just want to be limited. They just don't want to be limited to what they or who they could help.
So I'll answer that in two ways. The first way being that I chose marriage and family therapy versus the other realms of mental health because I originally started out going to school to be an educational psychologist. But I took my first class in the family, and the field of family therapy specializes in looking at individuals, couples, families, groups through the relationships. And so whenever I'm seeing a client, whether it's an individual or a larger group of people, I'm always thinking about people being in a relationship. And how does the intervention impact them in relationship? Because none of us, I guess the axiom for our field is you cannot not be in a relationship. Even the homeless person under the bridge is in relationships. And so you always have to think about the relationships in which people are embedded when you intervene. And that resonated for me as a person. That's really how I see the world, as more relationships versus kind of more individual, which was going to be the field that I was going in, which was educational psychology. So I guess my comment would be, learn about the different fields and decide what really resonates for you and what you feel to be your passion, and then pursue that particular part of the mental health field. Now, this goes into the second part of my answer, and that is, even though you decide to go one particular part of the mental health realm, it doesn't mean that you can't intervene in other parts, knowing that your scope of practice will be limited. So I, as a family therapist, can work with individuals but my specialty is in couples, families, families with children, relationships in the workplace or in groups. But I know that there's another set of practitioners, whether it's psychologists or LPCs, who their specialty is working with that individual and what goes on for them intrapsychically. And so they can also see couples and families, but they don't see them in the same way that I, as a family therapist, would see them. And so that would be the two parts of the question that, decide which field really resonates for you, but know that you can still intervene with a broader group of people, but your professional licensing group will set that scope of practice for you.
Thank you. Does anyone else have any questions? We don't have any in the chat.
I have a question for Joya. Joya, I know at the beginning you said that you've experienced kind of just negative feedback from clients just for being younger or being a person of color. How do you handle those situations?
We are taught that whenever we're faced with barriers to seek supervision, to talk it out with our supervisors. And we're also, as therapists in training, encouraged to be in therapy ourselves. So when we're facing these things, we can talk it out with our own therapist. And then, of course, just practicing self-care and understanding that I can't bring everything that happens in the clinic home. You have to compartmentalize. When I'm there, but when I'm home, I'm somebody's mom times two. So they need me there mentally, and I have to be able to break those things apart.
Thank you. So Joelle, I'll ask you a question. So I know that you have a huge following on TikTok, and you did get that designation as for 2021 from TikTok. Did you start your platform during the pandemic, or was this something that once you started medical school that you thought, I'm going to share, this information through TikTok? I mean, I just kind of, how did you get into that, and what compelled you to create that platform?
Mm-hmm. Yeah, so I joined TikTok during the pandemic, I think for the same reason a lot of other people did, for the memes and the dances. I did not dance though, and so I was a consumer for a while. I think I probably started in 2019 first, deleted the app for a while. But then I think it was during my first year of medical school when we first went into shutdown, and there were so many conversations happening about what it means to be Black in America. Ahmaud Arbery had been killed, and I remember feeling that so hard because I was 25 at the time, the same age he was when he died. And one of my favorite things to get like a mental break is to run. So I was looking behind my shoulder when I was running after that. Remember the George Floyd protests were going on at the same time, Breonna Taylor, the conversations that were happening there. There was all these kind of discussions about racial injustice. And I was thinking about my own pathway as a medical student. Being the first Black medical student at my school, I was part of Student National Medical Association, and I had founded it on my school's campus, but I wanted to do something on the larger context. And so I was hearing a lot about just the disparities of how COVID was more likely to impact Black communities, but not understanding, like not seeing the systems that it was talked about afterwards, just seeing it kind of put out there, and it sounded like it was related to biology when I knew it wasn't. And so I think the first video though I did was about the pulse oximeter, which is a device that you put on your finger and it measures your blood oxygen saturation level. And I'd seen a study circulating on social media that talked about how pulse oximeters don't measure skin color equally. In Black patients, it can actually overestimate your oxygen saturation level. What that means is if you actually are having shortness of breath, you can't breathe, sometimes that pulse ox will still show on Black skin as a high number, looking like it's normal when it's actually not. For me, I was like, whoa, we just had a pulmonology unit. We never learned about this. So I went to TikTok, and I'd been making videos about like just scholarships. And I think my first video had been like a trend of changing into Dr. Brooke from Grey's Anatomy. But that was my first one, just sitting and talking about something medical to the camera. And a lot of people started responding to it. And it was doctors and physicians and PAs and nurses saying, I've never heard about this. And I've been in practice for 30 years. And that kind of scared me that like people had never heard about it, even though they've been in practice for so long. And so I started thinking, hey, I should make this into a series about racial disparities in medicine. And I went down a whole, I now have about 15 episodes out of that specific topic, where I've talked about things like the glomerular filtration rate. I've talked about cardiovascular and how there's racial equations. I've talked about the ways that medicine, we're primed to think about race as opposed to thinking about the actual diagnosis, how sickle cell disease is inadequately managed in the United States, and all these other topics as well. I also kind of ventured into just disparities that exist overall in the world. I try and connect my life as a medical student, but also just my general life as a Black man walking through this world and things that I see. So I comment on political things that are happening. I try and share my own perspectives and opinions just for what it means from my lens. But it's been incredible to have an audience now. I think it's crazy. It's, I think, 400,000 people on TikTok that listen to random things that I say. I've gotten to speak everywhere from the FDA to like the NIH, and it's been really cool to be able to have an impact. And the FDA actually, a few months after I posted my video, had a chance to speak there, updated their website on the pulse oximeter and added a warning that said, hey, if you have darker skin, know that can overestimate. So I think we shouldn't underestimate the power of social media. Short form content is here to stay. If you have something you want to say, you can do it from your room now. And I think that's pretty incredible that we have this ability to impact change from no matter where we are.
Thank you. That's great. They're just commenting to follow you on TikTok. They put your handle.
Thank you.
I was like, what question is that? Oh, it's Joelle's TikTok. But that's great. I mean, I think just seeing the influence that you had on the FDA, I mean, that's major. I mean, that's probably like a big win on your book, as far as like things that you've been able to accomplish so far in your career. So that's awesome.
Absolutely.
Dr. Tubbs, in your profession or within your teaching, do you bring to, I mean, I'm not necessarily sure how many students of color you have, but do you kind of bring to light some of the disparities that individuals might experience being a person of color who might be seeking out treatment or therapy?
Yes, actually, both our doctoral and our master's students took several courses in reference to health disparities. Actually, they took, and our program is closing, so that's why I'm speaking in the past tense. But they actually had one class on treating Latino families, so that, you know, we're embedded in this particular context, and this is what we need to be paying attention to as marriage and family therapists. So not only that one class specifically for Latino families, and then they had to take several other courses that dealt with cultural responsiveness. And in addition to that, they had to take a pot class, and it wasn't that they were smoking it, but the pot is really an acronym for Person of the Therapist class. And in that class, they're also dealing with their own biases and the biases of others, and examining, kind of really unpacking who they are as a person. And part of unpacking that is unpacking some of the biases that you as a therapist bring to the therapeutic context. So we really try to educate them in terms of the theoretical aspect, and then personally they had to do reflection on that, and then they were also supervised, and were watched as clinical supervisors. Were also watching for those things and giving clinicians feedback on how they're interacting with clients and what they could have done or might done differently in order to be more sensitive or responsive to a particular client. So it's throughout the training.
That's interesting. I didn't necessarily, I mean, obviously I'm not a psychology or in a therapy, major, so I don't necessarily know those types of things, but that's good to know that that's actually included in part of the coursework. Joya, within your work, within your nonprofit for the Habitat for Humanity, do you get to experience any, or do you get to work with any of the families as far as within therapy, or just helping them just giving them some guidance. I mean, I'm sure that you probably deal with a lot of families who are of color, because I'm assuming that's pretty much like a lot of the population who seeks
Yeah, it is.
services.
So my work life and my student life are very much separate. So although, I'm training to be an expert in practicum, that's not my role here at Habitat. So unfortunately, those two roles are very separate here. So I don't get to do too much official therapy with families, but I'm always a listening ear.
Thank you. You're not like us here in our center. We call it trickle down therapy. So one of us is in therapy, so then we just spread it out across everybody. And we just, at this point, I have convinced all of my staff that they need to go see a therapist.
I have convinced everyone here that they need to go to therapy.
It's just so helpful. I mean, it's like having a friend to talk it out without having to like offend your friend.
They still come to me because it's free, so we'll work on it.
But if I'm trying to see, we don't have any more questions in the chat. Does anyone?
Something?
Oh, yes, ma'am. I'm sorry.
I'm sorry. Just when you were talking just a moment ago, I also remembered that in our program, we also exposed our students to faculties of all racial identities. So we had Latino, European American, African American, and then different orientations too, as part of the teachers that they were seeing too. So they also heard therapy from the perspectives of those particular professors. So I just left that off.
Thank you. And now before we hop off, I just want to ask this one question, because I just thought about this when you mentioned orientation. Do you notice any disparities among individuals of color? And this kind of goes for all of y'all. Individuals of color who might be either within the LGBTQ community, and do you see any disparities, or what are some of the pitfalls that those individuals might encounter within y'all's professions? So Joelle, if you want to go first.
Mm-hmm. Yeah, I think a lot about intersectionality and the importance of understanding that in someone's identity. I think for a lot of people that are from the LGBT community that are also POC, people of color, when they go into a hospital, they're trying to think about what identity is it that I show forth and how's it going to be received. Literally just the other day, one of my friends posted like a little blurb about how he wore his pride lanyard, and when he walked into the room to see a patient, the patient was like, you must be so brave. And the first things that went through his mind was, A, is he talking about like my race, or B, is he talking about like the lanyard that's around my neck? And it was neither of them. It was like he was working in labor and delivery with like a lot of like women doctors, and so that was what the patient was saying. But he always is thinking and having to be on guard about like, what are people going to see me today? What are they going to see me as? And so I think just those things can compound, especially when you have those dual identities of which one comes forth, which one do you actually show first, and how do people receive it, because you never know.
Thank you. Joya or Dr. Tubbs, do you have any experience within that, dealing with individuals within the LGBTQ community that might also be experiencing disparities within seeking services for mental health?
Sure. Go ahead,
Go
Joanne.
ahead.
No,
You got it.
I'll go after you.
I was just going to say, being a person of color, LGBTQ, and a woman is one of the main issues that I deal with in my sessions, because there is a unique set of difficulties that come with each of those identities. And so although, our programs are really working to make spaces safe, the clients still have to leave our offices, right? And so although we can be understanding to them, they are still facing like these complex issues outside of our clinics. And I just feel like there's a lot of work to be done in a bigger aspect to understand someone's intersectionality and how that impacts them as an individual.
Language is really important in our field, and just the way that we use language around people will give them, will convey some of our inner attitudes. And so one of the things that we do in training is actually listen for how our clinicians talk about their clients that may be LGBTQ, as well as the ways that when we look at our whole clinic infrastructure, are there barriers to LGBTQ clients coming in? You know, is our system set up so that there's a very traditional templating of what marriage is all about, and can we not have a female and a female as partners, or does every relationship have to be a male and a female? And so beginning to remove those type of barriers to our clients. I think that would probably be the biggest thing in terms of disparities, is just making sure that, especially in the field of marriage and family therapy, that for the students who come through and train with us, and especially if they're coming from, you know, religious backgrounds where, you know, they're just like, nope, we can't do that, asking them, okay, so what's going to kind of be the higher principle for you now? Is it going to be learning the principles of our field, or, you know, is it going to be religion? And we don't, we ask them at least to consider that what they do in their private practice, then they have to answer to our licensing board. But for the most part, we really try to invite students into that conversation about what it's like then for someone to hear that either the larger society or the therapist that they're coming to for help is not accepting of how they're presenting as a family or as a relationship, and try to remove those kind of barriers for clients that come to our clinic.
Thank you. So I will end it there. Thank you all so much for joining us today. This was really insightful. This was a really great conversation. So I really thank you all for taking time out of your day and joining us. For everybody who's in attendance, in the chat is a survey link. And so if you'll take that survey, so that way you can win some STEM Center swag. We will announce winners, I believe, by the end of this week, once we get all the surveys completed. But thank you all for joining us. And we do have another event next week, so please join us next Wednesday, same time, same place. Look on Alamo Experience for the information regarding that event. And thank you, Joelle, Dr. Tubbs, and Joya. Thank you so much for joining us today.
Thank you.
Bye.
Thank you. It's nice to see you all.
Yes.